ABC News contributor, Dr. John Brownstein. Dr. Brownstein, good morning. You know, we've got 134 million Americans at least partially vaccinated. We've heard there in Steve's piece, transmission numbers are looking better. So can we finally say we're past the worst of this pandemic? What do the next few months look like?
Hi, Dan. Yeah, I think we can be very optimistic, right? This 200 million shots in arms ahead of 100 days, it's going well. I think that with 26% of the population vaccinated, 40% with a shot, I mean, this is the pace that we wanted to get to the end of this pandemic. Now, we're going to see pockets of transmission like we see in Michigan, although that's starting to get better. So we're not completely out of the woods. We still have lots of vulnerable people to vaccinate, and a lot of people are in this wait and see category around the vaccine. And of course, we have to think about these variants. You know, overall, we see the vaccines doing well against the variants. We see very few breakthrough infections. So overall, great. We have work to do on the vaccine process to get more people vaccinated, to get that herd immunity of 70, 90%. We're going to have those kids starting to get vaccinated in the summer. So the outlook looks incredible. And I know we've said, you know, we're aiming for that normal summer, and I think it's going to happen.
And we've heard throughout that it's much safer outdoors than it is indoors. So as we hit the spring and summer months, do we really need to be wearing masks outside all the time?
Yeah, this is something that I've been bringing up for weeks now. I think it's time to start changing our perspective around outdoor masking. I mean, we know that 96% of cases happen inside. So there's just not a lot of strong evidence for masking outside, especially when cases are coming down. Yes, of course, if we're in a surge, masking outside makes sense. Or if you're in a mass gathering, like a concert where you can't really maintain social distancing, that makes sense. So I think overall, getting outside without a mask, especially if you have some level of distance, it makes sense. I think that is, you know, a key to arming people of the value of getting vaccinated. I expect that the CDC is going to start to change recommendations. Of course, have a mask in your pocket just in case you need it or need to go inside. But overall, I think we can start removing those masks slowly.
Right. Love hearing that, Dr. Brownstein. We also know that the number of people who've gotten the vaccine is slightly down this week. Does that worry you at all, or is that to be expected as more people get vaccinated?
You know, I think, of course, we're getting a lot of vaccine out, so we expect it to flatten out. But this sort of curve that we're seeing in downward trend is a little bit concerning. We had that massive rush among those that are vulnerable or older getting the vaccine because they really had the demand. Now, as we open up eligibility, younger populations, there's maybe more of a challenge. If it's not convenient, you know, not all mass vaccination sites are easy to access. So we have to think about meeting people where they are. This issue of hesitancy is definitely one that we need to consider, right? Are people concerned about side effects, or they don't maybe trust the vaccine, or maybe they don't see the value for themselves? So it's this combination of access and hesitancy. And so we have to combat with education, right? Explaining why these vaccines are effective, why they can reduce transmission in the community, why they can bring us back to a normal life, how they can protect your family and friends. So we need to be ramping up the effort around education to really get to those people that are on the edge of deciding whether or not to get the shot.
I mean, I personally know quite a few parents who have teens, and the parents are vaccinated, but they're hesitant to get their teens vaccinated. And I wonder, are you seeing that hesitancy go up since that pause in the Johnson & Johnson vaccine? Is there any kind of inkling as to how long we might have to wait before we have a final answer on those vaccinations?
Yeah, it's a really good question. We've been monitoring hesitancy, and so I think the temporary pause isn't going to have a meaningful impact. J&J vaccine was about 5% of all vaccines, so it wasn't a big impact. And in fact, hesitancy hasn't really changed because of the J&J vaccine. Specifically for J&J, people are concerned about it, but that hopefully is temporary as that pause gets lifted. I do have concerns about the places that were offering J&J. That's about 7,000 sites that only were offering it. And you have to think about the populations that maybe only wanted J&J because it was easier as one shot. Maybe it was better in rural communities where there's less access. So we have to be concerned there. But, you know, the CDC is meeting on Friday. The ACIP is going to make some recommendations. The expectation is they're going to unpause this vaccine because it is safe, and these outcomes around blood clots are very rare. But they'll probably put some, you know, potential discussion around age and likely sex, and some warnings around how we might think about administering the vaccine going forward. But I fully expect it to go back and start to be deployed into next week.
All right. ABC News contributor Dr. John Brownstein, always great to have you, Doctor. Thank you.
Thank you so much.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.